Hey everyone, so I'm making a video to explain what phalloplasty is. Not many people know what it is, which isn't too surprising since it's not really talked about much outside of the trans community, but trying to educate people, so hopefully more people understand why and what it is and how much of a process it is. So, first thing about phalloplasty is, it's usually called phallo or phalloplasty for short, but it's not just one procedure, it's many different procedures together. So you can actually choose any of these little parts. You can opt out, opt in, but if you were to get the full phalloplasty, that would be phalloplasty, which is making of the penis, urethral lengthening, which is extending the urethra to the tip of the penis from your original urethra. There's glandsplasty, which is making the glands or the head of the penis. There's scrotoplasty, which is making the scrotum, and vaginectomy, which is removing the vagina. There's also a stage 2, or in some circumstances, those parts are split into 3 stages, but in terms of my surgery, it's split into 2. The second stage is implants, so it's testicular implants that go into the scrotum, and then an erectile implant. And the implants are always done in a separate stage from all the other things if they're done together, but some surgeons split urethral lengthening into a second stage instead of just the first stage to reduce complications. So then there's different donor sites. So there's donor sites like the back, you can use the abdomen, you can use the leg, but I went and used my arm, which is called radial free flap forearm. That's the one that I got, so that's the one I'll be talking about. So they basically take skin, nerves, 2 nerves from the forearm, an artery and a vein from your forearm, and they use that to create the penis and connect it to blood flow and give it sensation. And here it is on me. So they took this, not quite all around, there's a little gap here, but over here, yeah. And it's actually faded quite a bit, so you can't really see it too much anymore, but it was a lot darker originally. And it's been about 8 months now, so there's different scar care you can do to also make it less dark, so that's another thing you can do. And it's not a dead giveaway if you've had phalloplasty, because not a lot of people know actually what that scar on my arm is, and actually not a lot of people have asked. I'm sure they're wondering, but I've only had about 5 people ask about it ever, and I just passed it off as just a burn, and no one questioned it. So the next thing I'm going to talk about is how the surgery actually works, and the length of it. So the surgery tends to be, depending on the different surgeon and what you opt in or out of. Mine was about 7.5 hours. 7.5 to 8 hours is the shortest time it can be, but I've heard it even being up to 14 hours long. So it depends on which surgeon you go to and what they're going to do. How the surgery works now is, so you have your donor site. You always have to have a donor site because you have to actually create it out of part of your body, so it is part of your body. And to cover that donor site, you need another site. So they used my leg, my left leg, and they took about this much of skin just to cover up my arm, because they do take the skin from your arm. That healed fine. It's just like a top layer. It's not too in-depth there. So what they do is, for mine, I can't speak to the others as much, the other donor sites, but they take this part of my forearm and they rolled it to make a tube, which made the urethra. And then they kind of made it a tube within a tube, as they call it, which they roll it again. So it's like rolled up. So you have the urethra in the center, which is its own tube, and they connect that to your urethra, and then extend it to the end, and then they take the rest of it, and then they roll it around that, making it so it has some girth and it has length. Generally with this arm 1, you get about between on average 4 to 5 inches long, although there have been some people that get 5.5 inches, some people that get, I haven't really heard of anyone getting less than 4. If you go with other donor sites, the size can vary, but the size that you get is a size that it pretty much stays after stage 2. So it doesn't grow and shrink or anything like that. It can for the first year, just while it's adjusting, but after that it's kind of stable. So it's unlike natal-born guys who have, who their shrinks and grows. So it's a little bit different in that aspect. So once they roll it into the tube, then they will connect the artery and the vein to your blood supply from your upper leg area and around your pubic area, and they actually attach it a little bit higher up, so it's in a more anatomically correct position. They can do burial of the clitoris, or they cannot. It's up to the person and what they want, and up to the surgeon. So for me, they did, and that's basically where they will actually bury it in the base of the penis itself, or part way down the scrotum. If you're long enough, you can have both. Then they connect the nerves from your arm that they harvested to the nerves in the clitoris. So that actually connects, and it makes like a network of nerves which slowly regenerate and create sensation throughout the penis. You can get tactile sensation, so just like light touch, pressure. You can get erotic sensation because it's connected there, and then you can also get temperature sensation. I've regained all 3 of those, mostly throughout the full thing, but it does take months, sometimes maybe even years, to get full sensation, if you do. But there is a slight chance you might not. It's a very, very small chance that you wouldn't get any sensation in the penis itself, but still the clitoris does retain sensation, and so you can always stimulate that, and you will always have that stimulation. So that's not, you won't lose it completely. And for making the scrotum, then they take the labia minora and majora, and they kind of harvest that, and they create a sac. And I had the VY technique, which I went to see Dr. Crane, and so he does that. That's basically where he just rotates it about 180 degrees and moves it up. That means that it's not in between my legs, and it's actually in a more anatomically correct position. Other surgeons do their own method. You can get like a joint scrotum, or you can get where it's more bifid like this. So it depends on which surgeon you go to and what technique they use, but they use that tissue. If you don't get vaginectomy, so you don't get removal of the vagina, it will remain below there, although they do take away the majora and possibly some of the minora if you do that, so that can really impact the look of what's left. So that is basically how the surgery's done. And then, like I said, they cover the arm, and then they use the leg split thickness graft to cover the arm. So while it seems kind of simple in what the procedure might do, in the terms I explained it, it's actually a very hard thing to prepare for, and it has a very long recovery as well. So prepping for it, I could go into so much depth about what I need to do to be able to even go through with this surgery, to be able to, I had to see several different doctors, several different specialists, psychologists. There were so many steps. Getting hair removal done on my arm, so that way there's not hair. Getting, and other things. But the one thing I will mention is you do have to do bowel prep for it, so you have to clear out your bowels beforehand, and you have a restricted diet about a day or 2 before, so that's the major preparing for it as the day is coming up. And recovery after, so the first 3 to 5 days usually, sometimes more, sometimes I don't think ever less. It is an inpatient, so you are kept in the hospital, and they keep you in the ICU, and they monitor you very closely. They first check every hour to make sure the blood flow is good with a Doppler. So it's a thing that makes like a whooshing noise. It just checks the blood flow to the new penis is okay. And then they start monitoring every 2 hours and every 4 hours, just as time goes on. You're not allowed to eat or drink anything really the first day in case you have to go for surgery again, in case something does go wrong. That's not super common, but it has happened. Didn't happen in my case. And you're on so many different pain meds. In my case, I was in the hospital for 5 days, and I had to lay completely flat throughout those 5 days, and I had tons of things propping up the new penis, and I had keeping it in a good position so the blood flow wasn't compromised. And I had nurses coming in, coming out. I don't really remember the first 5 days, but that's pretty much what it was. It was pretty intense. And then after that, I had to stay around the area where I had surgery for 3 weeks. I stayed in a skilled nursing facility, but you can stay in a bed and breakfast place. You can stay hotel. You should have a caretaker with you because you can't really bend. You can't do a whole lot. You can't lift. There's so much you can't do. But so you have 3 post-ops generally, and each one every week apart. You just make sure everything's going fine. You do have a catheter, and a catheter up your urethra in the beginning, and then that can get pulled. But you do have a catheter coming, suprapubic catheter going directly into your bladder, and that can be quite painful, causing bladder spasms. And that usually is in for about 3 weeks, and then it gets pulled. So it's about a month of major recovery, and then you go back home, and you still have about a month where you can't do a whole lot of lifting. You gotta be careful with your movements. And generally, after 2 months, if you don't have complications, you're okay. One thing though, when you do shower, it's pretty hard to shower on your own for the first bit. You have to cover your donor site while it's healing. They do put a splint on it, and it's kind of like to keep it in the same position while it's healing. You have that on for about 3 weeks or so. You lose a lot of independence doing this while you're healing. I needed someone to help feed me. I needed someone to help me shower, to help me change my dressings. I had so many people see me naked, so many different doctors. There was just a lot I couldn't do. I couldn't really move my arm. I had to go through physiotherapy to learn how to do this movement again, kind of get my grip back. So there's a lot of prep after too, and it definitely is something that a lot of people consider when going into this surgery, how intense it can be, and how hard it can be on your body, that there can be complications that can really affect things, but that's a whole other video. But overall, I'm very happy I went through this, and it really did change my life. Made me a much happier person, more comfortable with who I am, and while I did have emotional ups and downs throughout the recovery period, I'm overall much happier, healthier person now. So that's just my explanation of what phalloplasty is. I didn't go too deep into details about each part just because I could be talking forever, but that's basically what it is. So thanks, everyone.